Your eyes, nails, and skin may be giving you powerful hints about what's going on with your thyroid. Even feelings of anxiety, restlessness, or being on edge might be your body's way of waving a red flag. Many people don't realize that hyperthyroidism, when your thyroid becomes overactive, is more common than they think. And the signs? They're often visible, sometimes dramatically so. Let's start with the basics. Your thyroid is a small butterfly-shaped gland located right at the base of your neck. Despite its size, this tiny organ affects nearly every part of your body. It controls your metabolism, energy use, and even how your heart beats. The thyroid doesn't work alone, though. It responds to signals from your brain, specifically a hormone called TSH, or thyroid-stimulating hormone. When your brain senses that your body needs more thyroid hormone, it tells the gland to produce T4. That T4 then gets converted into T3, the active form of thyroid hormone. Think of T3 as the gas pedal for your metabolism. It tells your cells to speed up or slow down. But when too much of this hormone is present in your system, your body becomes overstimulated. That's when hyperthyroidism sets in. Everything starts to move too fast. Your heart, your thoughts, even your digestion. You may start to feel nervous, overheated, or constantly hungry. And the most common cause of this hormonal overdrive? A condition called Graves' disease. Graves' disease isn't just a random malfunction. It starts with your immune system. Normally, your immune system protects you. But with Graves', it turns against your own body, producing antibodies that mimic TSH. These imposters latch onto your thyroid gland and force it to churn out more and more hormones without any feedback from the brain to stop the process. Your thyroid has basically been hijacked. The result? An overload of T3 and T4 circulating in your body, affecting everything from your brain to your skin. Let's take a look at one of the most obvious and dramatic signs. Eye changes. In some cases, you can spot Graves' disease just by looking at someone's eyes. A classic example is proptosis, also known as bulging eyes. This happens when the tissues behind the eyes swell and push the eyeballs forward. It's not sudden, it builds up over months or even years, but it can become quite striking. What causes this swelling? The same antibodies that stimulate your thyroid also activate special cells behind the eyes called fibroblasts. These cells start producing a substance called hyaluronic acid, the same ingredient found in cosmetic fillers and skincare products. It attracts water and causes puffiness. Over time, the tissues behind the eyes swell so much that the eyes begin to bulge outward. This doesn't just affect appearance. In severe cases, it can lead to double vision or even permanent vision loss if the swelling compresses the optic nerve. Sometimes the first changes are subtle. You might notice swelling around the eyes or puffiness in the eyelids. You might even see the white part of the eye called the sclera above the colored iris when your face is relaxed. That alone can be an early sign of Graves'. Why does this happen? The excess thyroid hormone amplifies your body's response to adrenaline, even if you have normal levels of it. The result is a constant state of high alert wide eyes, racing heart, and jittery energy. There's also a physical test you can try with a partner or a camera. It's called the lid lag test. You ask the person to follow your finger with their eyes as you move it slowly downward. Normally, the upper eyelid moves smoothly with the eye. But in hyperthyroidism, the eyelid lags behind, revealing more of the white part of the eye. It's a subtle but telltale sign of how overstimulated your nervous system has become. Another visual clue? The blood vessels in the neck. If you see a strong, pulsing artery at the side of someone's neck, especially near the base, it could be a sign of an overactive thyroid. This bounding pulse is caused by the heart pumping more forcefully and the blood vessels dilating, both classic responses to excess thyroid hormone. Finally, pay attention to the base of the neck. A visible fullness there could mean the thyroid has enlarged. This is known as a goiter, and it's very common in Graves' disease. The immune system's attack makes the thyroid grow in an attempt to meet the body's demand for hormone production. It's not always obvious, though. Doctors often ask patients to swallow water and watch for movement in the neck. If the thyroid moves up and down, that can be a sign it's enlarged. Now let's shift our focus to the neck and chest. Sometimes, the thyroid gland grows so large that it doesn't just cause a visible lump at the base of the neck, it actually extends downward into the upper chest. This is called a substernal goiter, and it can press on important blood vessels that drain blood from the head. There's a simple test to check for this compression. Raise both arms straight above your head, like you're about to dive into a swimming pool. Hold that position for a few seconds while someone watches your face and neck. If your face begins to turn red or the veins in your neck become more prominent, it could mean that the enlarged thyroid is blocking the veins. This is called Pemberton's sign. When the arms come back down, blood flow returns to normal and the redness disappears. This test might sound strange, but it's a useful way to spot pressure in the upper chest. Doctors sometimes follow up with imaging, like an MRI or a CT scan, to see just how far the thyroid has grown. In some cases, the images reveal a huge mass pushing into the chest cavity and compressing the large veins. While rare, this can lead to serious complications and even mimic the signs of other conditions, such as tumors. That's why it should never be ignored. Now let's take a look at your fingernails. They're constantly growing through a process that requires a lot of energy. Since thyroid hormones control your body's energy production, they also affect your nails. One common change seen in hyperthyroidism is a condition called onycholysis. This is when the nails start to peel away or separate from the skin underneath. It's most commonly seen on the ring fingers and is often painless, which makes it easy to miss. This condition is sometimes nicknamed plumber's nail in the medical world. Why it happens isn't completely clear, but it's believed to be related to the rapid growth of the nail that outpaces its attachment to the nail bed. Over time, the detachment becomes more obvious, and some people may notice their nails becoming thin, brittle, or oddly shaped. Another subtle but important test you can do at home involves placing your fingernails together. Normally, there should be a tiny diamond-shaped gap between the base of the nails. If that gap is missing, and the nails are curved around the tips of your fingers, this could be a sign of clubbing. Clubbing is often associated with heart, lung, or liver conditions, but it can also appear in patients with hyperthyroidism. This physical change is a sign that something in the body's circulation or oxygen levels may be off. Now look closely at the shape of your fingers. In some patients with Graves' disease, especially those with long-standing or untreated cases, the fingers begin to look thick or swollen. X-rays in these patients often show new bone growth near the ends of the bones. The edges of the bone appear fuzzy or irregular. This is caused by inflammation and the activation of fibroblasts, the same cells responsible for eye and skin changes. This condition is called thyroid acropathy. The term comes from Greek and literally means thickening of the extremities. Although rare, it is a very specific sign of Graves' disease and usually appears alongside other symptoms like proptosis and pretibial swelling. The hands may feel swollen. The joints become stiff, and the deformity can be permanent if left untreated. Even before visible swelling occurs, your hands may show another early sign, a postural tremor. This is a fine, rapid shaking that appears when you extend your hands and fingers in front of you. It may not be obvious at first, but placing a sheet of paper on the backs of your hands can help highlight the subtle movements. This kind of tremor usually goes away at rest and is most noticeable during actions like holding a cup, writing, or reaching out. The tremor is caused by overstimulation of the nervous system. With too much thyroid hormone in the body, your system is constantly in a fight or flight mode. Your nerves become hypersensitive, and even small tasks feel jittery or rushed. This is the same kind of tremor you might feel after drinking too much caffeine, but in this case, it doesn't fade. It lingers, creating a constant undercurrent of tension. Hyperthyroidism doesn't just affect your hands and nails. Sometimes it causes more visible and localized skin changes, particularly on the shins. In some patients, firm, painless lumps begin to grow on the front of the lower legs. These lumps are often waxy in texture and contain visible dimples from hair follicles. Doctors refer to this as pretibial myxedema, a classic skin manifestation of Graves' disease. Pretibial myxedema is caused by the same process we saw earlier. Immune antibodies stimulate fibroblasts to produce substances like hyaluronic acid, which lead to swelling and thickening of the skin. Most of the time, it appears as reddish or purplish plaques that are firm to the touch. Though they might look alarming, they're usually not painful and don't cause itchiness. In rare cases, pretibial myxedema can become so severe that it evolves into a condition called elephantiasis. This is where the skin becomes massively swollen, thick, and distorted much so that it resembles the foot of an elephant. While elephantiasis is most commonly caused by parasitic infections in tropical regions, a similar appearance can happen in extreme cases of Graves' disease when lymphatic drainage becomes blocked by excess tissue buildup. Thyroid hormone doesn't just act on the surface, it has deep effects inside the body, especially on your muscles. When the body is flooded with high levels of T3 and T4, metabolism accelerates. But this high-speed metabolism comes at a cost. It causes the body to burn through energy reserves, including muscle tissue. One of the most common physical complaints in people with hyperthyroidism is weakness, particularly in the proximal muscles. That means the muscles closest to the center of the body, like the shoulders and hips. Patients may say they have trouble climbing stairs, rising from a chair, or lifting their arms to wash their hair. These seemingly small tasks suddenly require more effort, and it's not because of aging or lack of exercise. It's because muscle fibers are breaking down faster than they can regenerate. At the same time, many patients begin to lose weight. What's strange is that they often report eating more than usual. This isn't the kind of weight loss that comes from dieting or exercise. It's unintentional and usually rapid. The reason? The body is burning fuel at an unsustainable rate. Fat and muscle stores are used up to keep up with the hormonal demand. And while some may initially view this as a positive side effect, it's actually a sign that something is off balance. This overactive metabolism also affects temperature regulation. The thyroid hormones cause blood vessels near the skin to dilate, helping to release excess body heat. As a result, people with hyperthyroidism often feel hot or overheated, even in cool environments. They may start sweating more than usual, especially at night or during minor physical activity. Their skin often feels warm and damp to the touch. It's not uncommon for people to wear lighter clothing even in winter without realizing why they feel so warm all the time. The body's heightened state of alert also affects the cardiovascular system. The heart, like every other organ, responds to the gas pedal effect of thyroid hormone. It begins to beat faster and harder. Many people notice a racing heart, pounding in the chest, or a fluttering sensation. Smartwatches or fitness trackers often pick this up as a persistently elevated heart rate, even at rest. While occasional palpitations are common in the general population, and usually harmless, in people with hyperthyroidism, they can indicate a more serious issue. Over time, this overstimulation can lead to an irregular heartbeat called atrial fibrillation. Atrial fibrillation, or AFib, disrupts the normal rhythm of the heart's upper chambers and significantly increases the risk of stroke. That's why recognizing and treating an overactive thyroid early is crucial not just for comfort, but for long-term health. Beyond the heart and muscles, thyroid hormone affects the skin and hair. Many patients report that their scalp becomes oilier and their hair seems to grow faster. But this rapid hair growth comes with a downside. The quality of the hair suffers. It becomes thinner, more fragile, and more prone to falling out. This can result in overall hair thinning, noticeable shedding, or in some cases, patches of hair loss. Interestingly, some people also notice changes in the texture or appearance of their hair. It may feel finer, softer, or less dense than before. The increased oil production can also cause the scalp to feel greasy or uncomfortable, requiring more frequent washing. These changes are subtle at first, but become more noticeable over time. All of these affects muscle breakdown, heat intolerance, rapid heartbeat, and hair changes are signs that the body is being pushed too hard. It's as if the entire system is stuck in fast forward, running on adrenaline and high-speed metabolism 24/7. While the body is designed to handle short bursts of high activity, staying in this state continuously wears it down. That's why patients often feel both energized and exhausted at the same time. Their bodies are racing, but they're running on fumes. One of the more serious and often overlooked effects of hyperthyroidism is its impact on bone health. Over time, high levels of thyroid hormone accelerate the breakdown of bone tissue. This process decreases bone mineral density, making bones thinner, more brittle, and more likely to fracture. It's particularly concerning for older adults, who may already be at risk for osteoporosis. In fact, some people are only diagnosed with hyperthyroidism after they experience a fracture from what should have been a minor fall. The breakdown happens silently. Bone is constantly being remodeled. Bone is removed, and new bone is added. But when thyroid hormone levels are too high, this cycle becomes unbalanced. Old bone is removed too quickly, and new bone can't keep up. The result is weaker bones that may not show any symptoms until a break occurs. Beyond the bones, the effects of hyperthyroidism can be deeply felt in the nervous system. One of the most common complaints is anxiety. Patients may describe feeling on edge all the time, like they can't relax. They may be easily startled, irritable, or unusually sensitive to noise. Even small tasks begin to feel overwhelming. Many people say they can't shut off their thoughts, especially at night, leading to trouble falling or staying asleep. This chronic state of nervous energy is driven by the hormone's amplification of the body's response to stress. Normally, adrenaline levels rise during emergencies, helping you react quickly. But in hyperthyroidism, the body reacts to normal situations as if they're emergencies. The result is a constant flood of stress hormones, creating that wired but tired feeling that's hard to escape. Sleep becomes a serious issue. People often report insomnia, restless nights, and waking up feeling like they haven't slept at all. It's not just the physical restlessness, the mental overactivity keeps the brain from truly powering down. This sleep disruption only adds to the cycle of anxiety, fatigue, and irritability, making daily life feel even more challenging. Hyperthyroidism can also mimic a full-blown anxiety disorder. Some patients are even misdiagnosed with generalized anxiety or panic disorder before their thyroid levels are tested. Symptoms like racing thoughts, rapid heartbeats, shakiness, and panic attacks can easily be confused with psychiatric conditions. That's why it's important for healthcare providers to consider thyroid function when evaluating new-onset mental health symptoms, especially in patients without a prior history of anxiety. But the impact doesn't stop with mood. Cognitive function can also take a hit. Many patients, especially younger ones, notice they have difficulty concentrating. Tasks that once felt easy like reading, planning, or remembering appointments now require more effort. This difficulty focusing is often described as brain fog, and it can be both frustrating and discouraging. Studies have shown that people with untreated hyperthyroidism perform worse on cognitive tests compared to healthy individuals. Their attention spans are shorter, and their processing speeds are slower. Even though they may appear energetic on the outside, mentally they feel scattered or disorganized. In older adults, the cognitive symptoms can be even more severe. In some cases, they may resemble early dementia. Confusion, forgetfulness, and disorientation can appear suddenly, especially if the hyperthyroidism has developed gradually and gone unnoticed. This is particularly dangerous, as it may delay the correct diagnosis and lead to unnecessary evaluations for Alzheimer's or other neurodegenerative diseases. Fortunately, when hyperthyroidism is treated properly, many of these mental symptoms begin to improve. Anxiety levels drop, focus returns, and sleep becomes more restful. However, the longer the condition goes untreated, the more strain it puts on the brain and the harder it can be to fully bounce back. Diagnosing hyperthyroidism starts with a simple blood test. Doctors typically measure the levels of three key hormones: free T3, free T4, and TSH. In most cases of hyperthyroidism, T3 and T4 levels are elevated, while TSH is suppressed or completely undetectable. This pattern makes sense when the body is flooded with thyroid hormone. The brain tries to shut down production by lowering TSH output. The result is a biochemical picture that clearly signals an overactive thyroid. But the diagnosis isn't always that straightforward. Certain supplements, medications, and even lab interference can skew the results. One common culprit is biotin, also known as vitamin B7. Many people take biotin for stronger hair, nails, or skin. But biotin can interfere with the lab assays used to measure thyroid hormone levels, particularly the immunoassays that many labs rely on. Here's what happens. Biotin affects the binding of proteins in the test tubes used to measure hormone levels. This interference can create a false picture, making it look like TSH is too low and free T3, T4 are too high, even when your thyroid is perfectly normal. That's why it's critical to tell your doctor about any supplements you're taking. If you've been using biotin, you should stop at least 48 hours before any thyroid blood tests. Otherwise, you risk being misdiagnosed and potentially started on unnecessary treatment. Once a genuine hormone imbalance is confirmed, the next step is figuring out the underlying cause. In many cases, the physical symptoms are already pointing toward Graves' disease. The presence of bulging eyes, goiter, skin thickening, or tremors creates a clinical picture that strongly suggests an autoimmune process. To confirm it, doctors can order a blood test for thyroid-stimulating immunoglobulins, TSIs. These antibodies are the signature feature of Graves' disease. When they're present, it means the immune system is actively triggering the thyroid to overproduce hormones. However, not every case of hyperthyroidism is caused by Graves' disease. In some patients, the thyroid itself contains one or more nodulous small growths that produce thyroid hormone independently. These nodules ignore the signals from the brain and keep pumping out hormone even when it's not needed. This condition is known as a toxic adenoma when a single nodule is responsible, or toxic multinodular goiter when there are multiple overactive spots. Another possible cause is thyroiditis, inflammation of the thyroid gland. This can occur due to a viral infection, certain medications, or even postpartum changes in women. In thyroiditis, the gland temporarily leaks stored hormone into the bloodstream, causing a brief period of hyperthyroidism. Over time, the gland may recover, but some cases progress to long-term hypothyroidism instead. So how do doctors tell these different causes apart? One of the most informative tests is a radioactive iodine uptake scan. This test takes advantage of the fact that your thyroid needs iodine to make hormones. Here's how it works. You swallow a small pill containing radioactive iodine. It's not dangerous. The amount of radiation is extremely low and doesn't cause harm. After about 24 hours, a special scanner measures how much iodine your thyroid has absorbed. If the thyroid gland is working overtime as in Graves' disease, The scan will show high iodine uptake throughout the entire gland. That means all parts of the thyroid are hyperactive. On the other hand, if only one area lights up on the scan, it suggests a toxic adenoma. Multiple hotspots indicate a multinodular goiter. In contrast, if the entire gland has low or no uptake, it points toward thyroiditis or even a recent iodine overload. The scan provides a sort of heat map of thyroid activity and helps tailor treatment decisions. For example, a patient with a single toxic nodule may benefit from targeted removal or ablation of that nodule, whereas someone with Graves' disease may need a broader treatment approach. Another helpful tool is thyroid ultrasound. While it doesn't measure function directly, it provides detailed images of the thyroid's size, shape, and structure. Ultrasound can identify nodules, cysts, and other abnormalities. It also helps rule out suspicious findings that might suggest cancer, although most nodules are benign. Ultimately, a combination of blood work, imaging studies, and physical signs leads to a reliable diagnosis. It's important that this process be done thoughtfully, because misdiagnosis can lead to inappropriate treatments. For example, someone with thyroiditis may improve on their own over time, while someone with Graves' disease usually requires long-term management. Getting a clear diagnosis is also the first step toward getting relief. Hyperthyroidism affects so many parts of the body that it often feels like everything is out of sync. But once doctors identify the cause, they can build a treatment plan that helps bring the body back into balance. Once the diagnosis of hyperthyroidism is confirmed and the underlying cause is identified, treatment can begin. The first goal is often to calm the body down to stop the overwhelming flood of adrenaline-like symptoms and help the patient feel more normal. This is where beta blockers come in. Beta blockers are medications that block the effects of adrenaline on the heart, blood vessels, and nervous system. They don't reduce thyroid hormone levels directly, but they do blunt many of the worst symptoms like rapid heart rate, tremors, anxiety, and palpitations. Drugs like propranolol or metoprolol are commonly used and can bring relief within hours. For many patients, this immediate calming effect is the first sign that recovery is possible, but managing symptoms is only the first step. The real goal is to control the production of thyroid hormone at its source. For this, doctors typically use one of three main strategies: anti-thyroid medications, radioactive iodine therapy, or surgery. Anti-thyroid medications, such as methimazole or propylthiouracil, PTU, work by blocking the enzyme that the thyroid uses to produce T3 and T4. These drugs are usually taken daily and can reduce hormone levels within weeks. They are often the first line of treatment, especially for younger patients or those with mild disease. In some cases, they may be used long-term to manage the condition. However, these drugs can have side effects such as rash, joint pain, or liver inflammation, and they require regular monitoring through blood tests. The second major option is radioactive iodine therapy. This treatment takes advantage of the thyroid's natural hunger for iodine. The patient swallows a capsule containing a small amount of radioactive iodine, which is absorbed almost exclusively by the thyroid gland. Once inside, the radiation slowly destroys the overactive thyroid tissue over the course of weeks or months. This option is effective, convenient, and usually requires only one dose. However, radioactive iodine often leads to hypothyroidism, the opposite problem, because the gland becomes underactive after treatment. That's why patients who undergo this therapy usually need lifelong thyroid hormone replacement afterward. Despite this, many people prefer it because it offers a permanent solution with minimal procedures. The third option is surgery specifically, a thyroidectomy, which involves removing all or part of the thyroid gland. This approach is less common but may be recommended in certain cases. For example, when the thyroid is extremely large, when nodules are suspicious for cancer, or when other treatments have failed. Surgery provides immediate resolution of hormone overproduction, but it also carries risks, including damage to the vocal cords or parathyroid glands. As with radioactive iodine, patients usually require lifelong hormone replacement after surgery. The best treatment varies from person to person. Age, overall health, severity of symptoms, and personal preferences all play a role in choosing the right plan. Doctors often take time to explain the pros and cons of each approach, allowing the patient to make an informed decision based on their lifestyle and goals. Regardless of the treatment chosen, recovery is a gradual process. The body needs time to adapt as hormone levels return to normal. For many, the transition out of a hypermetabolic state feels like finally being able to slow down after months or years of running on high alert. The racing heart, the sleepless nights, the nervous energy, these symptoms begin to fade. People often describe the sensation as coming back to themselves. But healing isn't just physical. The emotional impact of hyperthyroidism can be significant. Patients may carry lingering anxiety, fear, or frustration about the symptoms they've endured. Supportive care, including mental health counseling, peer support groups, or stress reduction techniques, can make a big difference in the recovery journey. In time, most people with hyperthyroidism are able to return to full health, especially when the condition is caught early and treated effectively. They regain strength, sleep more soundly, and feel mentally clear again. And for those who once felt lost in a whirlwind of unexplained symptoms, having a name for their experience and a path forward can be profoundly empowering.